Healthcare workers at Lompoc Valley Medical Center are meeting the COVID-19 challenge. Lompoc is one of the hardest hit areas in Santa Barbara County, but as KSBY's Megan Healy explains, most of the hospitalizations are not community members.
Like many hospitals, the Lompoc Valley Medical Center has converted a wing to treat COVID-19 patients in case there is a surge. Well, the hospital CEO tells me that it's all hands on deck every day treating these patients, most of whom are inmates from the federal prison. To minimize exposure to patients and healthcare workers, the hospital created a COVID-19 wing to provide at least 10 more beds and retrofitted a large physical therapy area if more are needed. Lompoc Valley Medical Center CEO Steve Popkins says a number of medical professionals volunteered to help outside their normal field of care.
Our nurses in our surgery department are cross-training and have cross-trained in our medical department so that they could care or provide support for those COVID patients as well.
He says inpatients from the community are generally low.
The key issue is not so much how many were positive, but how many became ill enough to need hospital.
Not counting the federal prison, there are at least 60 Lompoc residents that have tested positive. Of the 3 that were hospitalized, 1 person remains. As of last week, at least 12 inmates were getting treated at Lompoc Valley Medical Center. Some are transferred to Santa Barbara Cottage Hospital depending on treatments needed. Popkins says recently there have been fewer inmate hospitalizations despite the number of cases rising. That number now 80. So far, no medical staff have tested positive for COVID-19, but the CEO of the hospital tells me some are self-quarantining as a precaution. As far as PPE goes, the hospital says they have enough N95 masks and isolation gowns for the next few months, but the need for more could change. I'm Megan Healy for KSBY News.
The hospital also has 2 triage tents outside the ER and urgent care. They're set up to separate people who are experiencing symptoms or are suspected to have the coronavirus.